Are you a chiropractor with a struggling practice, having a hard time finding and keeping patients? Is your staff falling short of expectations? I'm Dr. Scott Sawyer, and DC Trainings has the answers that you need. So tune in now and find out how. Hello, welcome to DC Trainings. I'm Dr. Scott Sawyer. Today is a great day to tie up any loose ends in your practice around insurance forms. So we're going to talk about that, and I'm going to give you all the details that you need to incorporate insurance forms in a way to streamline the report of findings process in your practice. And if you've been following along, we've been covering each step of the way that you need to really incorporate the report of findings. And in my own practice, because I'm in full-time practice just like you, I have myself and some of my CAs actually delivering the reports of findings to our patients to streamline the whole office and elevate our service level without adding more time to how long patients wait and to their process. So this is a really important key aspect that you'll want to incorporate because it also helps your patients to build their not reliance, that's not the right word, but to build their confidence in your ability to incorporate their insurance, right? When people pay a lot of money for insurance, they want to make sure that their doctor's office is utilizing that in a way because it's their hard-earned money and they're receiving a service at a doctor's office that in their mind should be providing for those services. So we're going to tie all that in with some great forms today that you can use in your practice to streamline this process. So let me go ahead and share my screen and show you the way that this is going to work. And the first thing I'll just mention, as you can see on your screen, is we are getting very close to our upcoming seminar on July 15th, where we're going to dive into the financial arrangements, which will have another section in that module on insurance payments. So we'll be talking about insurance payments as it relates to financial arrangements. Today, we're just setting it up with the forms, but please RSVP for that seminar on July 15th. That'll be our live seminar in my office in Santa Cruz. Please come, join us, share the day, spend time with other chiropractors, and we'll, of course, unveil the whole next module on that day. So let's get into these insurance forms. And here's just a quick picture of me going over the insurance forms with a patient. Very simple, very streamlined process. It obviously builds rapport with you and your patients when they know that you understand how to incorporate the forms. And we're going to go through these types of insurance. We're going to talk about general insurance. We're going to talk about personal injury, and we're going to talk about workers' compensation. So let's start with just an overview. Because with any case type, and it says this on the screen, but I want to go into detail on this in a minute. With any case type, creating value will lead to a willingness to pay out of pocket, leading to longer retention and increased profits. So what is that saying? What that's saying is you want to make sure that you build value first and foremost. For any patient that is coming in to see you, they need to value what it is that they're paying for. And the more we can build that value, then somebody's going to be willing to pay for that which they value, which conversely, what's happening to insurance reimbursements? They're declining in general. In general, a lot of insurances are paying less than they used to pay, fewer visits, bigger deductibles, those kinds of things. So if we can build value on the front end, then our patients are going to be more willing to pay for the part that's out of pocket because their insurance has been reduced. So we want to make sure that we keep that in mind and to really build our financial arrangements around, well, actually build our processes around building value first, and then the financial arrangements will follow. So just keep that in mind as we go through this. Actually, and I'm not sure why that jumped all the way ahead there, but hang on, sorry. Let me stop my share and I'll pause. So we'll pick up moving straight into the website at this point. I started to show you the forms on the PowerPoint, but it's actually better if we go straight to the website so I can just show you how this plays out on the real life forms that you'll be using in your practice. So let me go ahead and share my screen and we'll dive into these forms. And as always, you can come right to dctrainings.com. You can download these forms straight off the website, and there's videos that go with it and everything that you need so you can incorporate these. But let's just start with the first part of insurance forms, which is having a diagnosis. Now, I know that in a diagnosis, technically, the chiropractic principles of practice doesn't require that we have a diagnosis. What they require is that we have the results of an analysis. But in the insurance world, they require a diagnosis. So to follow their standards, we're going to use that diagnosis list. On the website, we actually have a diagnosis list sample, which I'll open for you. And on here, you can see how we've actually filled this in. Of course, you can get the blank one right off the website. But in this example, we have Mary patient who has a cervical subluxation unspecified. So that's an S13.101A, and A stands for the initial encounter. D would stand for a subsequent encounter, or S stands for a sequela. So this is filled out for you in a way that you can use this as a baseline. We've got a cervical subluxation. There is disc degeneration. There's a second thoracic subluxation or segmental dysfunction. There's also a lumbar subluxation with some disc degeneration as well. So that's an example of how you would fill this out and how that would be submitted to the insurance. Next up is the blank one. Like I showed you, you can print this off the website and fill it out directly. And next up is the insurance verification. Now, insurance verification means that we're verifying the benefits before the patient, we actually start providing services for the patient. And what we've done on this form, which is really beneficial for you, is we've provided some different codes or different ways that you can bill for a chiropractic visit. And incorporated in that is things like, how high is the deductible? How many visits does this particular insurance plan cover? Is there a visit number or is there a visit limit per year? Excuse me. And so on. So these questions are all questions that you want to verify before you not only set up the care plan for the patient so that you know exactly what services you'll be providing, but also before you start billing the insurance. So you'll be able to find all that out. So you can use this form. It's basically just a walkthrough form. You ask the questions as you go with the claims rep and get the information that you need. So that's all there for you to use. The next one is regarding personal injury. And for personal injury, this is a patient who was either in a car accident or they were in a slip and fall at a commercial building or a business, and there's a liability claim. In the case of a liability claim, you want to make sure that your forms are set up correctly, once again, so that you can document everything and have it be submitted for payment through the responsible party. So in this form, all the questions are here that you need to submit for the insurance claim. I'll add one more piece to this, because for those of you who do some personal injury claims, you know that some of those claims or some of those cases have attorneys, right? The attorney is representing the patient, and attorneys love this form, I have to tell you, because all the questions are on there. It details exactly what happened in the accident, and the attorney can use that to calculate what the total damages were for that particular accident. And from there, they can then calculate the settlement and the demand for care and all of the, well, not the demand for care as it relates to DC trainings, but their demand to the insurance company. So that form is there for you also to use for your personal injury. And it is a great form. It really covers lots of details, and it gets the file set up appropriately right at the report of findings. And then lastly, as we switch over, this would be a notice of doctor's lien. And in this case, this is when a patient comes in, they have a third-party claim or personal injury, and in that claim, as part of that claim, they're being represented by an attorney. And what this form does is that you want to get this signed by the attorney so that the attorney is obligated to pay your lien when the case settles. Now, sometimes that case might not settle for quite a bit of time. It could be a year out. But you want to make sure that that's on file with the attorney, because when the settlement comes in and they have to distribute the funds, they're going to look and see whose liens do I have in this file. And the liens that are in there are the ones that are going to be paid. I'll also add, sometimes if you have worked with attorneys for a while, that they'll sometimes want to negotiate your lien. And again, you want to have this form signed on file, because when it comes to negotiations, they don't have to negotiate anything if there's no lien on file. If there's a lien on file, they'll work with you, you can work with them, and you can come up with something that's a mutually beneficial settlement to where the patient's getting reimbursed for their pain and suffering, you're getting your lien paid, and the attorney's getting paid, and everybody's happy. So you want to make sure that you have this on file. And I recommend, when you have a lien on file, have a phone call with the attorney, because the attorneys that you develop good relationships with are great referral sources, number one. And number two, when it does come time for them to settle the claim, if you know ahead of time, maybe if there's some limitations on the claim, if maybe it was a low impact claim, there was not a lot of damage or injury, obviously you're not going to want to rack up a huge bill if it's probably going to be reduced later. So it's a good idea to just get on the phone with an attorney that's representing your patient, have a quick conversation with them. Hey, we appreciate taking care of this patient. Certainly want to make sure that any records you need from us, we're happy to provide those for you. Oh, by the way, I wanted to make sure you got our lien. Do you have that on file? Yes, great. And is there any limitations on this case that you could foresee where we should maybe hold back on providing services that aren't quite as maybe some of the services that are a little more discretionary, right? I mean, there's obviously, you need to provide the care that the patient needs, but you might have some more discretionary services that you would like to offer, but maybe if down the road they might not be paid for, you might withhold those if they're not so much of a requirement. So lots of great ways to use this form in terms of your relationship building and in terms of your negotiation with your third-party claims. So that brings us back to the homepage here. And actually let me share my screen again. There we go. And so you can see why all these forms are on the site for this week. And using these forms, you're going to be in a much better place to, as it says right on the screen, blend insurance benefits into a wellness model to build trust and value. Okay, blend insurance benefits with your patient's care plan, and that'll build trust and value. But it also, the insurance, and I'll just kind of leave you with this parting thought, the insurance is more of a stepping stone to wellness in all of our patients' cases. Like, everybody would love to be healthy and well and, in top shape. Sometimes when patients come in, they're not at that point, and it's because they had a fall or a slip and they have insurance that they want to use. Just about all insurances don't cover wellness care or maintenance care, if you want to call it that. The insurance coverage is a stepping stone to get our patients to where they ultimately want to be, which is in wellness. And since they don't cover that, it's our job to explain the difference between the two. Here's what your insurance covers. Here's how here's the part that they will play in your care plan. And then here's the part that we want to get you to so that your spine is healthy and you're enjoying the quality of life and health that you deserve. So we'll put those two together right from the start and make a big picture and actually help you out in the best way. So your ability to connect those two sections is important for patients to understand and get, as we say in chiropractic, the big idea, and then all else follows. We go for it every time and we do the best we can. So as always, if you have questions with DC Trainings, let us know. You can reach us at dctrainings@gmail.com. Today has been a recorded webinar. I had to leave town unexpectedly for a couple days, but I pre-recorded this for you just so you'd have this ready and that you would be on top of your game when it comes to insurance forms. And to let you know, I'm looking forward to seeing you on July 15th at our next live seminar. And in the meantime, I'll see you next week for our weekly webinar. Thanks again for watching. Stay in love with chiropractic, and I will talk to you very soon.
If you would like to become a member of DC Trainings, be sure to head on over to dctrainings.com to get started today.